meeting back to order, and we will take up item D3 or 11 o'clock, time certain. We have Forest Service, Forest Supervisor Dave Harris.
Good morning.
Hi, Dave.
How are you?
Good, how are you?
Good. I just had one specific item for this morning. It should be on your agenda. I'll update on the Bogard Spring, simply because it was in the news here a month or so ago, so folks may be curious. There on the Bogard Work Center, of course, is on public land managed by the Forest Service, and just across the highway is the Caltrans rest area, which also sits on public land managed by the Forest Service. It's under a special use permit from us. And the Forest Service holds a water right for water on Bogard Spring to come to the work center, and through the special use permit we can also share that water with the state at the rest area. Of course, that works great in a time when we're not experiencing extreme drought. And so this year, what we had to do on the Forest Service side of the highway is essentially move out everybody but the essential fire personnel. Folks that did our resource work, they're involved in research. We had to house them elsewhere on the forest and in town. And in turn, we couldn't continue to provide the water we'd like to this Caltrans under their special use permit. So essentially where we are right now is we're both short of water. Caltrans has the rest area closed with just porta potties on there. We have just real minimal staff there than we typically have. So the longer term plan is to partner with Caltrans to drill a well, use a groundwater source rather than a surface source. And it looks like the Caltrans will most likely have the ability to actually drill the well for us, and then we're enter into a permit or agreement with the Caltrans to do that. What level of environmental analysis we'd have to do on the Forest Service side of things depends on where we decide to put the hole. If we're within the boundaries of the administrative site that we have there for our administrative use, then typically the environmental analysis is more straightforward, less timely, and it goes more quickly. If we're outside of that footprint, then we're into perhaps a different situation. So anyway, the goal there, of course, is to partner with Caltrans to provide the service there at the rest area throughout the season, relying on a groundwater source, and hopefully be able to provide that service next season throughout and not have it closed and not affect their own operations. So that's really all I had on the Bogard Springs, but if the board has other items on their mind, certainly open to hear those during the time allotted.
Dave, thank you for the information. Is there any questions?
Is there any other your facilities, offices, stations, or water?
None that I'm aware of that's severe at Bogard, and what we've been basically the agency as a whole has been conserving water in all our facilities.
Like up Eagle Lake area around there?
At Eagle Lake, our engine sits either at the Spalding station or at the Cal Fire station there nearby, and I haven't heard about anything that severe.
Always been up there.
Any questions?
Who's going to put in the pump? I mean, is that going to be the Forest Service or Caltrans puts in the pump after the well's drilled?
It hasn't yet been decided. We're going to meet here next month with Caltrans and kind of brainstorm and scheme out what the best scenario might look like, who would actually install and operate and maintain the pump.
How many gallons a minute do you need for that?
I'm not entirely sure. I don't remember the figures. Surprisingly, I think the numbers we were showing, the rest area was actually, use was less than the work center with all the folks we had up there, which was kind of surprising to me given that the rest area is open 24 hours a day. But Caltrans has done everything they can to reduce water use like most facilities, and we did the same on our side.
Dave, thanks again.
All right.
Sorry, I'm sorry, Supervisor.
Yeah, one, just as long as he was here, we had recently in the boardroom some constituent concerns about what we're doing with the timber management on the Diamond Mountain Range here south of town.
Sure.
And I know that Hannah has talked to you directly about that, so I was just kind of curious what you see, what could we be doing to help you guys to maybe elevate the attention and focus and maybe action as it relates to doing something there on the Diamond Range before it becomes a problem.
Well, and what we are doing is finalizing our program of work for the next fiscal year, looking at a variety of criteria that decide whether those priorities are going to get worked on or deferred to another year. So really haven't come to that conclusion what we can do next year. In the meantime, I would say, you know, the board can think about where within the county within the part of the county that lies within the forest there, you know, where do your highest priorities lie? And if you think that's one of your higher priorities, I'd certainly, you know, encourage you to let us know about that. And, you know, think about it obviously within the context of fuel reduction and fire protection, and, you know, economic stability for the county and what sort of commercial timber can come off a project like that, I know is an interest and a concern of the county. So I would be weighing all those things, knowing that, like everybody else, we have limited capacity to work any one place at one time. You know, and you know, some of our emphasis, most likely this coming year, is going to be the restoration, probable timber salvage on the Baldwin Isler fires, where to properly do restoration, to set ourselves up to regenerate a forest for the long term and reduce fuels, you know, we need to typically move into those burned areas, at least the areas of high severity burn, and do some active management. Other areas that are lightly or moderately burned, we may not have to be so active. So those are the sorts of things that we have to shift around priority-wise in the meantime. So the Diamond Mountain project is certainly on our minds, and, you know, where that falls out in the whole scheme of things, you know, is yet to be determined for next year.
Well, I think as a priority, I mean, obviously you have to deal with the areas that would be burned, but I think it's unfortunate that we have to let an area burn first before we become active in terms of trying to manage it. And I think the priority that we see is that there should be some emphasis to try to thin and clear up areas to make them more resilient when a burn takes place, so we aren't having to do what we are seeing now maybe being done in the Isler or Bald area. And I think that's the message that we're getting from the community, and I think that's the message we would like to try to convey to you and to your associates as to what can we do, you know, to try to deal with it. I mean, Randy Moore was on national news here a couple nights ago, you know, kind of dealing with that same exact question as it relates to the King fire that is, you know, heading towards the Tahoe Basin. It hasn't quite reached into the basin, but if it gets to the top and doesn't stop until it reaches the shore of, you know, Lake Tahoe, I mean, that creates a dynamic. And he talks about the limitations the Forest Service has in terms of dealing in those kind of situations. I mean, it started out relatively small, but it doesn't take enough for a fire to get going. When it goes, it goes. And I think the community would hate to see, you know, the entire escarpment here south of town turned into a desolate wasteland because we don't have time. And I think that's the issue that we need to try to focus on. So if it's resource allocation, is it personnel, is it prioritizing? I haven't heard of the board in recent years taking an action to prioritize areas around the county in terms of where the Forest Service should focus its attention. But if that's a door that's open to us, I'd highly, you know, encourage you to put the diamonds high up on that list. And
Sure.
there could be others. That could be through one all the way down the South Escarpment, Thompson Peak, all the way down through Milford. And I know the various fire areas are working with Fire Safe Council pursuing projects, but there's only so much that's designed to try to, you know, insulate the communities that are developed from the effects of the fires coming into the community. But let's look at the landscape as a whole, and that's something that I think would be really worthwhile.
No, I think, you know, it's pretty obvious that, you know, we aren't funded to the level we need to be to do the level of fuels work that we think the landscape demands, as evidenced by these large fires and probably what Randy shared the other day. And I know there's legislative efforts to look at that because, as you well know, we get in a fire season in the Forest Service, we have to take a big chunk of our budget, fight fires with it, and we borrow from our other programs, and there's legislative efforts to end that. I think that would provide some stability to the agency as a whole to do a better job of managing fuels rather than putting out fires after the fact.
Yeah. Well, at least the discussion's taking place in that system. But we appreciate anything you can do to in it. And as I was saying, Mr. Chairman, Dave, you know, along the line as he's dealing with his day-to-day decision making, if there's something that he sees that we could be of an assistance. If you can slip that information to us so that we can work to support you getting something across to whoever the higher-ups are to get the job done. You know, we're here for that purpose, so.
Sure, I appreciate that.
I just probably ask you to strongly support Jim's statement, but what he said is right on.
It's just, it's almost, it just goes against every bit of
I
common
know.
sense, you know, why they.
Is it the will of the Forest Service to manage the habitat or to let it burn?
We're not in the business to let things burn, you know, especially when you have a drought like, you know, this season. You know, we can't obviously afford to do anything but actively suppress those fires and keep us along.
It's more the will of the environmentalists to
Exactly.
let things burn. You know, they fight, I know, I mean, I sit on the biannual thing with the representatives from other rural counties with Randy Moore, and I hear it's just, every time they try to do a sale, it just gets blocked, you know?
Yeah.
By the environmental groups. It's crazy. Even the salvage sales, they hold them up so long in court, the timber's worth nothing. And then they don't even, so most of the salvage cuts don't even take place, so. It's the world we live in.
Well, we'll keep working.
All right.
We have community pressures that are building for that, and hopefully the petition drive that Hannah's put forth, and I know a lot of people are supporting that, and maybe when the congressman comes to the town looking for his votes for the next election, we can emphasize the importance. Maybe we can also work on the 2 senators, so I'd like to see us maybe put together some communication along those lines that, you know, I think that's where the level of the fight's gotta take place, in allocating the resources. Based upon what Randy Moore said on TV the other night, you know, it doesn't sound like it's a very good mix for us to prevent something from becoming catastrophic.
Thanks again, Derek.
All right, thanks, Larry.
Thank you. Okay, let's take up item H4.
Good morning again. Melody Brawley, Lassen County Health and Social Services. We're here this morning to ask for your adoption of a proclamation declaring October 5th to October 11th National Mental Health Awareness Week here in Lassen County. And I would be happy to read this proclamation if you're fine with that, or I can discuss it. Whereas 1 in 4 American adults suffers from a diagnosable mental illness in any given year, but many do not seek support because of fear of judgment, isolation, or discrimination. And whereas the stigma associated with mental illness can be more destructive than the illness itself, and whereas early support and help for mental health challenges can reduce suffering and save lives, and whereas the Each Mind Matters campaign continues to raise awareness and fight stigma to improve the lives of those affected by mental illness and/or substance use disorders by raising awareness and educating communities about the prevention, treatment, and recovery resources that are available, and whereas Lassen County employees and community partners desire to show support and come together to spread awareness about the importance of mental health and speak out against the stigma surrounding mental illness. And whereas October 5th through the 11th is National Mental Health Awareness Week, and countywide events are planned to offer information, resources, and ways for everyone to join Each Mind Matters, California's mental health movement and shared vision of mental wellness and equality. Now therefore be it resolved that the Lassen County Board of Supervisors does hereby proclaim October 5 through 11, 2014 to be National Mental Health Awareness Week in Lassen County, and calls upon our community to observe this week by wearing the Each Mind Matters green ribbons and sponsoring and attending programs and events that support this campaign to raise awareness and end the stigma of mental illness. The foregoing proclamation was hopefully duly adopted at a regular meeting of the Board of Supervisors of the County of Lassen, State of California, held in Susanville on the 23rd day of September 2014. And I have with me today 2 of our local NAMI members, the National Alliance for the Mentally Ill. You probably recognize them, Kathy Durden and Jackie. My mind just went blank, Jackie, sorry. And they are here, they've got some information to hand out. We were hoping to have our supplies, which would be a lot of green ribbons, similar to this one I'm wearing here. But they didn't come in, and we had to do it today because the next board meeting is until after Mental Health Awareness Week. So we're not quite as prepared, but we will get some more information to you as we go along, especially the ribbons. We hope all of you will wear them. We'll be handing them out in other organizations to community partners and departments around the county to ensure that everyone has a green ribbon to wear. Green symbolizes rebirth and growth, and that's exactly what we want to accomplish with folks who have mental illness and substance use disorders. Jackie, Kathy, would you guys like to say something?
We have these handouts for you.
And to Susan.
Thank you.
Kathy. Go ahead, Jackie.
The NAMI organization is the National Alliance for Mentally Ill, and Kathy Durden and I are members of the local NAMI chapter, and we also go to conferences, and we're also very interested because of family members that we have mental illness, and it can be very devastating to the family and the community. And the earlier that people get treatment means that the earlier that people can save damage to their brains from the mental illness. It's actually a disorder that many times has chemical properties to it. And we would just like for you to be aware of the fight against stigma in this community. The sooner people can, stigma is one of the main reasons why people delay getting mental health treatment. And so we're just here to, as a NAMI member, to help promote the awareness so people can get mental health services sooner.
And we hope that wearing the green ribbons will open up a dialogue. When people ask what it's for, you can share it.
Thank you.
Thank you.
Look at you guys.
Thank you, Molly. Is there any questions or any comment by the public on this item?
I would move, Mr. Chairman, we adopt all of the information that was just read.
Okay, it's been moved and seconded. All those in favor say aye.
Aye.
Chair votes aye. Thanks again.
Thank you.
All right, we will take up our 11:15 time certain. That's item D4 on our agenda.
Thank you, Mr. Chairman. John Mino, Under Sheriff. We're here, what we brought before the board today is a consideration on a request for proposals that we published related to correctional health care here in Lassen County in support of both the county jail and the juvenile hall. We've been working on this project largely since March, when we first got the notice that Dr. Meadows intended to retire. We wanted out of the business of working in our local correctional systems. We worked with some local providers initially to try and put something together. We ended up putting a stopgap together where Meadows has stayed on as the medical director, and then we have a combination of a physician's assistants and a nurse practitioner that have been coming in hosting daily sick call, both for us and for the juvenile hall. When we put that before the board in June, we put that together as we said then, an interim stopgap where we wanted to try and put out an RFP for a very comprehensive jail health program. We published that throughout the state and locally. We sent it to some of the very big correctional health care providers that specialize in this field. We also sent it to some of our local providers to see if there was any interest locally. In the end, we got one responsive bidder. That was from California Forensics Medical Group, or CFMG, and frankly, gentlemen, CFMG is the leader in this industry in our estimation. The Sheriff and I have had a good chance to see them and interact with them, both at different state sheriff's functions and then throughout some of our contacts and counterparts in other counties. Once this came back, we started doing an assessment and appraisal of the proposal they put together. We pulled together and worked with CAO's office, with county council, with probation, with HSS. And us, obviously, the ones that would be most impacted. Since then, we also reached out directly to some of our nearest neighbors that are CFMG counties. Sheriff Groudon spoke directly with Sheriff Pacinko in Shasta County. They are and have been the CFMG county for a number of years. very happy with the level of service, very happy with what they're getting. I spoke directly with Sheriff Honey of Butte County. They've been a CFMG county for years, are very happy with what they're getting. I also spoke directly with the jail commander in Glenn County, and they too are a CFMG county, and of course are more closely sized. They're a better match for us, say, than Butte or Shasta, either one. And so far, I mean, we haven't found a complaint. They're all very happy. Glenn County told me the only thing in his estimation that they did wrong is they undershot it, that they didn't get enough, they didn't bid it out with enough hours of nursing coverage when they put this together. So all of the reviews have been very solid. The proposal was very comprehensive. I did a breakout in the staff report that kind of breaks down just some of the highlights here. Obviously, one of the biggest ones, gentlemen, we're getting between us and juvenile hall, between 4 and 5 hours a day right now of medical folks on site in either the hall or the jail. This would bump that to 16 right away, 16 hours a day of nursing coverage, and that has a huge ripple effect throughout our operation. Whether it be when we talk about intake screening and having medical personnel there that can help us screen folks for whatever their conditions are when they come in the door to decide whether or not we accept or reject the bookings, which is a big deal, because if we reject those bookings on the front side, they have to go get medically cleared. And to get medically cleared before we take them in. Once we take them in and accept them, they're ours, along with all of their ailments. And sometimes people are suffering from medical conditions where they need to be rejected and cleared first. So having medical personnel to help with that obviously is a huge step from where we are today, where a lot of that's happening with correctional officers. The daily triaging, to have actually nurses there for more hours of the day to help triage emerging and urgent conditions and make a determination as to what needs to happen, who needs to be at sick call, who needs follow-ups and things of that nature. Lab tests and imaging, right now we go off-site for every bit of this. Blood draws, x-rays, CAT scans, MRIs, you name it. We need a test, we have to go outside the facility. Clearly, every time we take an inmate outside the facility and out in the public, we're taking them outside of the 4 secure walls of the jail, we're transporting them through town, we're taking an officer out of the building for who knows how long to get them back, and trying to coordinate those in amongst getting people to court, in amongst dealing with other issues that come up during the day. So the chance of being able to do more of those things on site, have nurses there that can do blood draws and take care of a lot of that lab work without ever leaving the building, it is really a big deal. On the pharmacy side, as it stands today, our correctional officers and juvenile hall counselors deliver medications to our inmates and wards, respectively. That is perfectly allowable under the law, although that is not something that we, that's a risk factor. I think we can all agree there. We don't have a medical person who's scrutinizing those prescriptions to say, I just gave you this pill, and before I give you this one, is there any kind of problems, complications, dangerous drug interactions that could take place? We're basing, all those things are happening based on a doctor's order, but to have that medical person standing there helping get those pills out to those people at every pill delivery clearly puts us in a better position when it comes to what are we handing people, what are the potential side effects. It's just that will bring us, well ahead of where we are today. Medical records, right now we're taking care of all the medical records, our custody clerks are. Which is a challenge because between our custody clerks and our custody supervisors, they're having to try and coordinate follow-up appointments, make sure people get from anywhere from the eye doctor to the foot doctor to whatever specialist they need. And those supervisors are trying to get that done in amongst getting people to court, in amongst here's a new booking, in amongst there's a fight in the special housing unit, everything that should be occupying their time from a custody standpoint, the medical side really takes away. But to have medical people that are there to take care of these records, take care of the continuity of treatment that the inmates are getting is obviously is a big deal. And the psychiatric side, to have some access to telepsych services in the jail that we don't have today, to have a licensed clinical social worker there for a period of hours throughout the week puts us well ahead of where we are. We'll still have a heavy interface with Lassen County Behavioral Health when it comes to suicide watches, and if we have to place a 5150 hold to try and get somebody off-site to go to Napa or one of the other state hospitals. But this will give us a higher presence of psychiatric care than we've ever had. And frankly, gentlemen, there's just too many benefits to try and wash them all through. I hope you got a chance to take a look at this. This really is a seismic kind of a transformational change that we've not seen, neither the sheriff nor I, in our career. If we can put this together now, we're going to shift from a model that was put in place 25 years ago, that at the time probably met the needs of a smaller, less populated jail and bring us to a standard where we need to be today. And, keeping in mind, gentlemen, this is a moving target. This medical services for inmates is always on the move. The sheriff talked to the Secretary of Corrections last week, or 2 weeks ago now, and they've went from where, like in their CCFs, they could have as few as 10 hours of nurses a day to now it's 24. So this is a moving target. The standard is getting higher. This is not a question of really how much should we do or how much shouldn't we do, what should we or shouldn't we be doing for inmates. We have a constitutional obligation to provide the services to the inmates. This has the, this will bring us to the standard. This will bring us to where we need to be, knowing that that the bar will continue to raise. On the finance side, this is the trickiest part to predict, and we put a finance page in there. We talk about this on the very last sheet of the report. There is a spreadsheet, and what you will see is there's a comparison on the top that looks at the 13-14 fiscal year. What did we pay versus what would we pay if we had CFMG on board? There are still some things we're going to be responsible for. If we have to take an air ambulance ride, that's going to be on us. There are certain pharmaceuticals, the high end for HIV, AIDS, blood disorders, things of that nature that we would be responsible for. So we tried to pair out what we paid last year versus what would we have paid even if we had had CFMG, looking at last year's numbers, and it still would have been 91 grand on top of whatever the CFMG contract is. Just looking at the some of the stuff to Banner, some of the stuff to Renown, some of the stuff to Med Flights. And again, that could be that same number this year, it could be half that, it could be double that, because again, this medical scenario is so terribly unpredictable. What this contract would do for us is it would make our medical more predictable. CFMG would pick up the tab on the first 10 grand of hospital visits. We would be picking up the tab on the back half. Now under the ACA, as once that funding frees up, we should hope to see that once those people are out of jail and in the hospital for 25 hours, that we should be able to recoup some reimbursements through ACA. So there should be a cap now that hasn't been in play. And then along at the bottom of that page, if you take a look at what the adopted budget was for this year, for jail doc, jail hospital, juvenile hall doc, and juvenile hall hospital, it's a little over 1.1 million, 1,124,299 versus the CFMG proposal that is 1,067,000. And even if we had to spend that same 91 grand this year that we would have spent last year for those overages, for those air flights, for those extended stays, that would take the tab this year to 1,158,000, or about a $34,000 difference. Now, we're not going to stand here today and say if we do this, we're going to be able to do this for $34,000 more dollars. That's the way the numbers pencil, but as is always the case, one significant, a significant issue, somebody that comes in with a blood disorder, somebody that has to be shipped out multiple times, that really is a moving target. But in the big picture, if you look at the comprehensive plan that is here, all inclusive with the docs, with the nurses, with the psychiatric that's not there now, with the pharmacy, and with the picking up the first part of the hospital coverage, the labs, the x-rays, and everything that goes into this, it's not even a comparison to what's happening now. When you talk 4 hours a day versus 16 hours a day, we're going to have medical folks on the ground. This is an easy one for us to say that this just has to happen. Now, understanding this is going to cost some more money, but this is going to give us a better position for the health care we're providing. It's going to give us a better defensible position when, not if, when a suit comes down for medical conditions that are happening in either our adult or juvenile correction system. So with that, we're take any questions.
You barely even took a breath.
Start timing.
Well, I just want to quickly say that, incredible work. But you point out that this may end up being a few $1,000s in excess, and when you refer to the 2014-15 budget. But the thing is, that was emergency fix, you know, but it's not stable. I mean, that.
Good point.
I mean, those were some last minute things that you guys miraculously pulled together. Otherwise, that could end up being $200,000 more next year. Those were people that stepped in, you know, to help you guys, you know, did some, you know, pulled in some, I don't know, call them favors, but I mean,